Do hypertrophic scars go away? So technically no scars actually go away. They just become finer and thinner and less noticeable with time and with treatments. Hypertrophic scars are scars that aren't flat, but they grow and can become larger within the confines of what the original scar is. If this growth of the scar goes beyond that confine of what the original scar is, that becomes a keloid. So those are two different things, but very similar in the way that we look at them and the way that we treat them. If these are treated, and this can include keloid treatments, injectable keloid, this can be injectable 5FU, this can be lasers, different things that we can do to help them become softer. They will become softer and less noticeable with time. Can you cut off a hypertrophic scar? It's usually not advisable to just cut off a hypertrophic scar. There's some sort of inflammation that's going on that causes it to be hypertrophic. If you know exactly what that cause is and you can take that away, there's a possibility that you can remove it. If this is something that occurred after infection, after a procedure, or infection after an earring piercing, if you know that that's not going on anymore, you could potentially remove that scar and it would heal okay. Most of the time, you do have to do some treatment for that hypertrophy of the scar, including steroid injections, 5FU injections, sometimes laser treatments help, other microneedling can help to soften that scar and to make it more amenable to removing and not just coming right back. That is how I usually address these, is we will do treatments to get it to a very good place to where the chance of it coming back is very low, remove the scar, and then continue those treatments. That heals as a nice fine scar that's not easy to see. What is the best treatment for hypertrophic scars? This can depend on why it's hypertrophic. If this is hypertrophic because there's inflammation from an infection, from a procedure, once that inflammation is gone, then you can start proceeding to plan to remove it. If it's hypertrophic because you had a procedure and there's tension on the incision, like with a facelift, if you had too much skin that was removed and you have tension on where that's closed, sometimes this can cause hypertrophic scars. In that case, it's better to treat that with things like steroid injections, 5FU injections, and possibly lasers, rather than removing scar and causing more hypertrophy. Depends on what the cause is for the hypertrophy. But a lot of times that will include steroid injections, laser treatments, and non-invasive treatments for the scar before or in place of surgical treatments. Have questions? I help people like you every day. Email anytime or schedule a consultation at drangela.sturm.com. Thanks for watching.